this section, we'll start thinking about how to write the study methodology. A little part of study methodology we are also going to talk about tomorrow and in the next week also. So we once again come back to this document and keep on coming back to this document because that's a document which is formal official guidelines, and all our guidance here in this course is an expansion to what's there in the primary guidelines. So in the other sessions we talked about other things. Now we move on to methodology. Methodology is a very big part. We discussed the importance in the previous session, around 800 words. Many times students wonder as to what all can I write to make it 800 long words, right? So it's not necessary that it has to go to 800 words. It's not necessary that you have to force fit to write everything and make it 800 words. Even if it is 750 words, even if it is 700 words, that's perfectly fine. What the guideline suggests is that the relative length of introduction and methods. So it would not be a good idea if your introduction is 500 words and your methodology is 300 words. Your methods have for sure has to be longer than your introduction, right? And this session and the subsequent sessions would help you identify the elements of clarity that you can bring through words in your methodology section, right? So that you can populate it in more words at the same time, provide more clarity, right? One of the traps that many of the other students would fall into is, so for example, they might give command to an AI saying that my current version of the methodology is 350 words, make it 800. Your AI would be able to give you 800, extend it to 800, but all those 800 words, all those extra words that the AI has given you might not be meaningful. And your reviewer, it might end up irritating your reviewer, right? So in this course, we are trying to clarify as to what can you potentially include in the methodology. Many parts of the methodology section that we are going to discuss are not part of the original guidelines, this one-pager guideline, right? But they are under our understanding as to what components of methodology makes it more meaningful, relevant, clear, and hence that's what it would be expected. So let's go into the detail. We have identified, so these 8 sections are the words which is there from that document, one-pager document of STS proposal guidelines. And we are going to talk more into detail about each one of them. The first one is easy, the type of study we have discussed. Study design, study setting, and study sample. So these are the 4 things that we are going to talk about today in this session. The next 2, what are the study variables in more detail and what is the data collection process? We are going to talk about next tomorrow on Tuesday. And the next week, we are going to talk more about the statistics and analysis plan and how do we prepare the documents for the ethics committee process. Right? So let's talk about these 4 today, the top 4. So type of study is something that we have already covered in the previous session. So these are the possible types of studies, whether it's clinical investigation happening within hospital setup, epidemiological investigation probably happening in the community setting, field operational research where you are trying to find out how the government health program works, or you are doing some intervention. If your study is health education, or if your study is around laboratory investigation, or if your study might be developing a product or somebody else has developed a product and you are trying to find out how good the product is, how well does it work in rural settings. Or your study might be somewhere around the management, right? So next part is, since we have talked about it, it could be just one sentence in your methodology saying that your study is a clinical investigation or your study is an epidemiological investigation. The next important element is study design. Now, study design is an important element. So established study designs do exist that fit a particular study objective. So each of your study objective might have a different study design. A single phrase of study design. In the next slide, we are going to talk about what are the different study design options available to us. But a single phrase, so for example, a cohort study or a cross-sectional study, conveys very clearly into the mind of all the scientific audience, right? So all the doctors who have studied research methodology. So that single phrase, there is a uniform understanding in everyone's mind as to what a cohort study means, or what a cross-sectional study means, or what an experimental study means. So there is a clear and uniform understanding. right? So when we utilize that just one word or terminology as study design, we are conveying a lot of information, right? And depending on what the reviewer reads as study design, the reviewer expecting that your following description in the methodology would be as per your study design, right? So if your study design is cross-sectional, they'll expect that you would have gone to people just once and collected the data. If you say that it was longitudinal, they'll expect that probably you followed up your study participants over a period of time and found out if an event of interest develops among them or does not develop or something of that sort, right? So although it would be just one single line in your methodology, but that's one of the most important lines in the methodology, right? So these are the possible options. So this is a simplified version of how do we arrive as to, I have a broad idea in my mind as to what's my study topic. And this particular flowchart or algorithm would help you narrow down to what would be your study design, right? In the next slide, we will also talk about what are the theoretical concepts, but this is a practical way. So how many groups of people are you having? So we talked about this in the earlier session as well, right? So if you are dealing with only one group, it's more likely to be a descriptive study. If you have two or more groups, it's more likely to be an analytical study. When you are dealing with one group, so when the patients with one single health conditions are described, so if only one patient is described, we call it as a case report. If more than one patient are described, it's a case series. So these are usually cases which are very unusual, right? So see, for example, during the COVID time, we encountered the cases of mucormycosis. So we understood that mucormycosis, where there is black coloration in the mouth, was not so common. But after COVID, we realized that a lot of cases started appearing. So for many physicians, it was an unusual case and a lot of cases happening. So they wanted to report this to the scientific community, bring it to the notice of scientific community. So a case series in such a scenario would make sense. But usually, case reports and case series are discouraged in ICMR STS. So you will find anything which is beyond these two. Right? So the other category is patients with defined characteristics described. So patients are contacted only once, or patients contacted more than once. Right? So when you go to your study participants only once, it's called as a descriptive study and a descriptive cross-sectional study. So say, for example, let's take an example. So over here, you get one example, which is to estimate the ability of school students to read nutrition table. So this group of students who are doing STS project go to the schools, meet the school students only once, and probably give them an MCQ test and identify the ability of school students to read the nutrition. Right? Or we had another studies where we go to the villages and find out if they can identify common snakes. Right? So they go to them only once and find out something. So that's a descriptive process. Another example is when patients are contacted once. So you start with a group of people and then try to find out whether something happens among them. Right? So let's take this example where this study is, so this is another study of descriptive cross-section to estimate the prevalence of vitamin A deficiency signs in a specific tribal school population. Right? So this is once again a descriptive cross-section where they go and meet students within a tribal school and find out what proportion of such students are having vitamin A deficiency signs, probably in their eyes. So in just one contact, and it's descriptive cross-section. Let us take another example. This is our familiar study to estimate the median time taken from symptom onset to hospital arrival among the myocardial infarction patients. So, for example, assume that the student takes up a list of all the patients who are admitted and probably goes to the people and asks as to when did the symptoms start and when did they arrive, right? So there are two time points. So time point number 2, the duration between those two time points is which the student is interested. Or let's say if the student is doing retrospective data collection, the student might take up the telephone numbers of the patients from medical records and take history from patients telephonically, call them up and then ask this history. So this could be a descriptive longitudinal study. Another descriptive longitudinal study would be, for example, if someone takes up a cohort of pediatric patients with sickle cell anemia and then collects their phone numbers and follows them up over a 6 months or 1 year period time and asks them, did you have sickle cell crisis episode during last 6 months or during last 1 year, right? So then the student will come up with what's the 1 year incidence of sickle cell crisis among the sickle cell anemia or sickle cell trait patients, pediatric patients. So that's a longitudinal study where you follow up a group of people with some condition over a period of time to find out what's the event of interest. The other group is when the other condition scenario is when you have 2 or more groups. So either it could be an observational study or it could be an experimental study. So if you are doing some kind of an experiment, which we say that educational experiments might be allowed in STS. And if you are not doing any experimentation, you might just be observing different groups of people, right? So researcher is not doing any active intervention here. The researcher is letting the natural events pass by. So 3 scenarios, exposure and outcomes measured at the same time. So I mean, these are the new terminologies to us, what's an exposure and what's an outcome, right? So exposure is something which happens first and outcome is something which happens afterwards, right? So there could be 2 kinds of studies usually. The study could be a cause-seeking study, right? So it would say that a particular risk factor is an exposure and the disease is an outcome. So say for example, a consumption of packaged food or consumption of high fat diet or consumption of high consumption of plain sugar can lead to, let's say, polycystic ovarian syndrome. So consumption of plain sugar is an exposure and polycystic ovarian syndrome is an outcome. Right? So an exposure and outcome. So in a cause-seeking study, the risk factor or cause of the disease is an exposure and disease per se is an outcome. The study might be treatment seeking. What are the treatment options available? So in this case, the scenario changes. So the disease per se becomes exposure. So we have people with the disease, and then we have the different outcome, right? So the treatment-seeking studies will here the exposure would be the different treatment modalities, right? So say for example, the PCOS might have treatment modalities such as giving drugs to the patient. Another treatment modality could be giving lifestyle modification to the patient. We ask the patient to, say for example, practice yoga, practice dietary restrictions, and probably start exercising. So lifestyle modification could be an intervention and drugs could be an intervention, right? And we might wish to find out whether the patient's symptoms improve after lifestyle modifications and after giving them some kind of a drugs, right? So these kind of interventions or these kind of treatments or these kind of management options or treatment options become the exposure, and the cure or reduction in the symptoms become the study outcome. So in the treatment seeking studies, the treatment modalities become the exposure and the cure becomes the outcome, right? So when you are doing the study, it might happen that the exposure and outcome have already happened and you are measuring them at the same time. So when you are doing analytical cross-sectional study, that might be the case. So let us take an example, right? So let's assume that body mass index, one of the tools to measure obesity. So we assume that obesity might be an exposure, might be a risk factor for developing polycystic ovarian syndrome, right? So when you are going in obstetric department OPD and going and meeting patients with polycystic ovarian syndrome, they already have the outcome. And probably you can also measure their BMI, right? So both of them, they are there. And you are measuring them at the same point in time, right? So this is called as analytical cross-sectional study. There is another study which is called as cohort study, where the exposure occurs first and you measure the exposure, the outcome has not happened yet. And then you measure the outcome in future, right? So say for example, think of this study, where at the start of an academic year, you identify students studying in 10th standard in schools, right? And at the start, in the first week of they enrolling into their 10th class, you measure the weight of school bags and classify the students into 2 categories. Those students who are having the weight of the school bag more than 5 kgs and the weight of school bag less than 5 kgs. You divide the student into 2 groups. Now, when you are measuring this weight of the school bags, you cross-check and verify that none of those students have backache. Then you meet them once again after 3 months and ask what proportion of students from both the categories have developed a complaint of the symptom of backache over the period of last 3 months, right? So, in a sense, we are trying to find out the incidence of backache in these two groups: students with the high weight of school bags and students with low weight of school bags, right? So, this could be called as a cohort study, right? Where once again you are not doing any intervention, the school bag weight is determined by themselves, and you are just observing the phenomena occurring in nature. It could be cross case control study as well, where the exposure and outcomes have already occurred, but you divide people in terms of cases who are having the disease and controls who are not having the disease. And you follow them up both to find out what proportion of people with the disease have the risk factor and what proportion of people not having the disease have the risk factor. So let's take this example. So you are interested in finding out whether platelet indices can predict, or are there a risk factor which can help you predict hypertension in pregnancy. So you take up two groups of people. One is women, two groups of pregnant women. One is apparently healthy pregnant women, the other women are women with hypertension in pregnancy. And then to both of these women, you go to previous medical records and identify, let's say, what were their platelet indices, probably the first trimester of pregnancy or the second trimester of pregnancy. So that could be an example of case control study. The last category is research doing with an active intervention, and we say that educational studies might be allowed, right? If randomization is used, it would be called as a randomized controlled trial. If it is not used, it's called as non-randomized trial. Many times we do before-after studies usually and measure the outcomes before doing the intervention and after doing the intervention. So, say for example, we took this example just now as to before-after intervention study to improve infant feeding practices, right? So, this was such an algorithm which probably might help us arrive at the study design for our respective studies. If we go to the next slide, this is a more refined, the theoretical conceptual map that the studies could be descriptive, there could be cross-sectional, longitudinal, analytical could be observational and experimental, and what's not included here could be studies of medical tests. So if your study happens to be in the laboratory departments, you might be trying to find out, so for example, if a new way of diagnosing or screening the disease is useful or not. So you might be wishing to see that what's the reproducibility, or what's the accuracy? Does it correctly identify people with the disease, right? Or you might be interested in its feasibility as well, right? So feasibility means that if we employ, do the doctors find it easy to use, or does the patient find it comfortable to use? Right? So these were some of the things that we wanted to discuss about study design, an important element of